gentlemen, brothers and sisters, to another episode of Anatomy of the Church and State. I am your host, Jeremiah Campana, and today we will be discussing how our very own government has made protecting the preborn intentionally more difficult for doctors. We're going to challenge mainstream abortion narratives and show Christians how they can engage pro-life skeptics. But before we jump into it, would you kindly hit that like button, subscribe to this channel if you're not already, and share the show with your friends. With me today, she is a board-certified OB-GYN with over 25 years of experience and vice chair of the American Association of Pro-Life Obstetricians, I hope I said that word right, and Gynecologists. Yeah. She frequently contributes to outlets like the Federalist and Newsweek. She champions life-affirming healthcare grounded in faith and science. Ladies and gentlemen, please welcome Dr. Susan Bane. Dr. Susan, thank you so much for joining me today.
You're welcome. Thanks for having me.
Well, I'm just going to jump right into it. But before we get to the government stuff and how they've been kind of hindering doctors, I'm curious. Tell us a little bit about we'll call it APPLOG for short, and how your Christian faith informs your approach to medicine and what biblical principles guide your work.
APPLOG is an acronym for the American Association of Pro-Life Obstetricians and Gynecologists. We are a medical organization. We've been around for over 50 years, and we have about 8,000 members, a wide variety of healthcare professionals, not just OB-GYNs, but all doctors who want to practice life-affirming medicine and don't see the direct and intentional killing of another human being, whether it's early in life or later in life or anywhere in between, as part of healthcare. Our mission is really to educate, to equip, to empower healthcare professionals to practice life-affirming medicine. And I'm just honored to be part of a pretty incredible organization that really wants to support the current generation of doctors and healthcare professionals, but also that next generation that's going to be caring for us and taking over the profession. So your second part of the question, what drives me in this direction? I was very blessed to grow up in a home where the dignity of life was taught to me very early, and respecting life from conception to natural death was a part of my world. And I saw it in my parents. I saw it in the service work they did. But I think I saw it the most when I have a sister who, as a teenager, had an unplanned pregnancy. And they loved her through that. And they loved their granddaughter through that. My niece now is in her 30s. And she is a mom, a wife, and has 2 children of her own. And my sister is a Gigi. And so I grew up with that strong foundation, and then I went to medical school. And, all of us, when we become adults, we have to decide, do we stand on the foundation of faith our parents taught us, or do we step away from it? And for me, it was super easy. I opened chapter 1, page 1, paragraph 1 of my embryology textbook, and it literally discussed human development begins when the egg and the sperm fuse at conception. Then you have a little embryo. Then you have a fetus. Then you have a newborn. Then you have a toddler, a child, a teenager, a young adult, an older adult. There was just this continuum. And so it was so common sense that the science that God created aligned so beautifully with the what I was learning in medical school. And it became a no-brainer for me, really. But I had to, so much reason and faith get pushed together. But in reality, they align beautifully, and they don't have to be. But I think it really was me. I did have a defining moment in medical school where I had to decide, was I just going to talk the talk or walk the walk? And I'll briefly share that story because I think it was pivotal to give me the courage that I have now. I'm not a naturally brave person, but also I think part of our conversation today is to give other healthcare professionals, other lay people, the courage to also walk the walk.
100%. Yeah.
it was midnight. I was an intern, meaning I was a first year resident. I'd graduated from medical school, but I was kind of low woman on the totem pole when it came to the hierarchy of medical education. About midnight, I'm in my call room and I get a text. A labor and delivery nurse is asking me to come to labor and delivery to start an abortion, to put some medicine, some medicine that would start dilating the cervix of a woman who had a baby with Down syndrome. And I hung up and I told her, I'll give you a call back. I called my senior resident who oversaw me and I just told him I was not comfortable participating in an intervention in which one of my patients would intentionally die. And he actually supported me in that decision. But I vividly remember being in green scrubs and a long blonde ponytail and dropping to my knees in that call room and saying, God, you've given me these convictions. You have got to give me the courage to follow through on them. No sooner had I said that prayer, my pager went off. I had to go to a different patient, but I left the call room and I turned right and I immediately bumped into Dr. Frank Gay, who would one day end up being a partner in the practice I was in. He introduced himself and he said, are you the new intern with the pro-life feet on your lab coat? And I said, yes, sir, I am. And he said, I just want you to know you may feel alone, but you're not. And I smiled, I thanked him, and I thought, wow, God, you answer prayers mighty fast. And it was that moment where I said, I'm not alone in this fight, even though sometimes in medicine it seems like that. So that was really the pivotal moment. And I guess I'll say one other thing. In my mid-50s, 21 to 2022, I spent a year at Duke Divinity School. They have an amazing program called Theology, Medicine, and Culture. And I got to understand how Christianity informs the practice of medicine. And it was a game changer. It helped me articulate why I believed what I believed. And so it's a lifelong journey for all of us, that's for sure.
Yeah, that's a powerful story. God does move in miraculous ways. I'm glad that He impacted you that way, because you don't hear those stories of doctors. Thank you for your pro-life stance. We always hear about all the doctors who champion abortion and never the pro-life side, at least from mainstream media. What we're hearing, you said a lot of good stuff there too. I think it's important. The younger generation, I think that's been a huge problem in our culture. Is just the sanctity of life is just. It's just been kind of non-important, and we're not teaching young kids how important life actually is. And then another thing that I love apologetics, and I follow a lot of apologetics on YouTube and X, and faith and science they're not mutually exclusive. They actually go together very well. And most people, and that used to be taught in American schools, and it's not taught anymore. So I'm glad that you found that connection, because there is a connection there that I think most people miss. So in your journey, from your perspective, maybe things have changed recently, but what are some ways that federal or state governments have historically kind of hindered pro-life efforts through the medical side of things, such as funding abortion providers or restricting pro-life speech, in healthcare settings?
Well, I think you have to answer that question by first looking at what is the purpose of medicine. And if the purpose is health, healing, and wholeness, then the direct and intentional killing of a human being has no place in medicine. But what has happened is one of the leading medical organizations called ACOG, the American College of OB-GYN, which many state and federal level governments follow their recommendations. ACOG has their famous statement, abortion is healthcare. And that has picked up a lot of energy. And what it is, besides being a blatant lie, it is then leading to a lot of regulations that don't value both patients, our mom and our baby. And, it comes across, and like what you see it is conscience protection rights, for example, of healthcare professionals. Our conscience is really that inner sense of what is right and wrong in our conduct, in our motives, and it impels us to act in a certain way. And healthcare professionals need conscience protection rights. I needed to be able 30 years ago to not participate in that intervention that was going to end the life of that baby with Down syndrome. We need regulations that continue to do that. The problem has been is that while we have federal laws in place, it depends on what administration is in place as to whether or not violations of these laws get pursued by the administration.
Very true.
And so strengthening conscience protection rights is really important to APPLOG and is one of our main priorities in terms of that. I think one of the other interesting things that's happened in medicine is when I trained, I could do what's called opting in to learn abortions. So if I wanted to learn how to do an abortion, I could tell the person head of my residency program, I want to learn to do this. If my hospital didn't do it, they were responsible for sending me somewhere where I could learn it. It's totally shifted. In 2022, the accrediting body that oversees residency education switched it to opting out. So I was opt-in, it's now opt-out, which means you have to be brave enough to say, I'm not going to do that in a culture that has maybe that morning had a lecture titled Abortion is Healthcare. You have medical education is militaristic in its organization, meaning the med student is here, then a little higher up is that first year resident, then the resident, then the fellows, and then attendings. So picture this. This is what residents and med students endure today in many schools. You're in rounds. Someone says, go to OR room 25 and cover that DNC. Dilation and curettage. It's a surgical procedure. You think you're walking down there and the woman's had a miscarriage and the baby's already dead. And you get in the room and it's a living baby that you're being asked to scrub in and help. You have an expectation now with this opt-out. You have an expectation that you're going to stay there unless you're brave enough to tell the people who are grading you, to tell the people who are deciding whether you pass the rotation, graduate from medical school, finish your residency, that I don't want to do this. So what's happened now is they're normalizing abortion as part of healthcare and even discouraging individuals like myself from going into OB-GYN. And so APPLOG is also working on trying to change that back to opt-in. If you want to learn to do it and it's legal to do it, okay. But don't create a culture that normalizes it when, and your audience may be surprised to hear this, 76 to 93% of OB-GYNs in 3 different peer-reviewed journal surveys do not perform induced abortions.
Wow.
It's only about 10 to 14%. It's a very small percentage, yet you'd think we all do it, right? From the way you hear it. It's a really small percentage that do it. And what APPLOG's really trying to do is awake that sleeping giant, that 74 to 96% that don't do it. They don't do it for a reason. And some people will try to say they don't do it. It's not reasons that are ethical, but it's such a money-making machine that if they really didn't think it was a bad thing, they would be doing it because you can make a whole lot of money doing it.
Yeah. Oh my gosh, you brought up so many questions. First of all, I can't imagine how many young doctors are, get paralyzed with fear in those moments. That's just crazy to me. And then, how many, now I'm thinking like, well, who's getting failed because someone has a different ideology than that person if they were to object, and maybe they came up with a different reason and didn't say it was because you're pro-life, but failed you anyway. I just does that happen? Do you think are there people that are grading you with ideologies that might scrutinize that decision and that contributes to that fear? You think?
Yeah, people, students, residents report feeling discriminated against. We know it happens even in the admissions process. They have to
Mm,
navigate their beliefs to get admitted. We fortunately have some wonderful attorneys across this country and organizations that represent religious freedoms and conscience rights. And so, thank goodness, we have that. But I can't even imagine being a 20-year-old and having to do that and feel brave enough. One of the best, most wonderful things about APPLOG that warms my heart the most, we have an annual medical conference where doctors go and get continuing medical education credit, nurses, nurse midwives, all kinds of health professionals. And we have scholarship funded to bring in med students and residents so that they can come for a 3-4 day conference at no cost to them and be surrounded by like-minded individuals, so they actually believe that they're not alone, that they can go into medicine and hold to their conscience rights. And I think it's one of the most powerful things, because our members, our friends and supporters of APPLOG are the ones who bring these students there. So we're empowering them. We're not the only ones out there doing that. There's some other great organizations doing similar things, but we recognize we will lose the profession of medicine. We will lose that trusted care that you and I have to have when we go see our healthcare professional. We'll lose it if we don't help this next generation really understand the purpose of medicine and why they have to stay with the Hippocratic Oath, do no harm, and care for patients the way medicine was designed to be.
yeah, for sure. That's awesome that y'all do that. And that I think what you just said, combined with all the distrust after COVID, with the medical
Mm-hmm.
industry, I mean, we're creating a situation in which nobody's going to seek out healthcare because they don't trust the doctors,
Yeah.
and the doctors don't trust other doctors, and it's just we got a situation here that definitely some battles ahead that I think we can and will win. There is one thing you mentioned previously that kind of brings us into the realm of misinformation. You said that this term that was coined, abortion, is healthcare, where it's like, since when is terminating the life of somebody healthcare? It's absolutely not. I agree with you. And so how let's talk about some misinformation. So how did we get, I mean, science still thinks that life begins at conception, correct? So where did we get, how did we get to where we don't think that's an actual human? Because I hear that a lot, not from doctors, but from just people on social media, or just liberal friends out in the world, that they don't think that is a person in there. So tell us, what are some of the, besides that, tell us a little bit background on that, and then tell us some of the other biggest pieces of misinformation that is out there when it comes to pro-life medicine.
Yeah. One of the things I get often asked is, what surprised you the most after Roe was overturned
Hmm.
on the Dobbs decision, right? And I absolutely was shocked by the intentional amount of chaos that came from my profession. And actually, to your listeners, I want to say I'm sorry on behalf of my profession, because it's
Hmm.
coming from us. And it is intentional, and it is designed to create blame of pro-life legislation. But the one that surprised me the most was that it seems like we as a profession forgot what an abortion is. So I think it's really important that your listeners understand what is an abortion and what isn't. So I'm going to start there. So abortion in medicine is an umbrella term. There are different types of abortion. When we use the term, when I have a patient that calls and she says, Dr. Bane, I am spotting, I'm cramping, I bring her in, she does an ultrasound, and everything looks fine. She's having what's called a threatened abortion, or a threatened miscarriage in lay terms. Okay. She calls me back and says, I've started bleeding heavily. I repeat her ultrasound, and now her uterus is empty. She's actually had a complete abortion, or a spontaneous abortion, or a miscarriage in lay terms. So those are all, that's a natural process. There's been no intervention. Her body miscarried. The baby likely had a genetic issue, that its little brain, its heart, something couldn't keep it alive, right? Okay, so you have that type of miscarriage / abortion. That is completely different than what Roe and Dobbs is about. And everybody in my field knows that, okay? Roe and Dobbs is about something called an induced abortion, which the Center for Disease Control, the CDC, our country's largest public health agency, defines it as an intervention with the intention of terminating a pregnancy and not resulting in a live birth. So let's break that down. It's an intervention. It's something done to the woman.
Mm-hmm.
Today, 70% of the time, 60 to 70%, it's giving abortion drugs. The other percentage is doing surgery. Okay, so it's an intervention with the intention. Intention matters. Okay, the intention is to not result in a live birth. So the intention of an induced abortion, whether it's drugs or surgery, is to have a dead baby at the end. Okay, so what is happening in my field, and this same organization, the American College of OB-GYN, is actually leading the way and impacting lay people, how they vote, impacting how governments are run at the state and federal level. They're basically trying to do two main things, and it had been working, but APPLOG and other organizations are pushing back hard to educate the public about this. The first thing they're trying to do is change language to dehumanize the embryo. So they actually have documentation, practice guidelines, briefs out that tell me as an OB-GYN that when I dictate an ultrasound, when I talk to a patient, I'm supposed to use words like cardiac activity and not say heart rate. I'm supposed to not in the first trimester, I'm not supposed to say living or viable. Wow. I'm not supposed to use the word baby. I'm supposed to use the word fetus or embryo, which those are perfectly normal medical terms, but most of my patients aren't medical, right? So I use lay terms all the time. Jeremiah, if you came to me, well, you're not a woman, so you're not coming to me, but let's say your wife did, and she needed a medicine under her tongue, I would say, take this under your tongue. I would not say to her, take this sublingually, even though I might write that on the prescription. If I thought she was having a heart attack, I would walk in the room and say, I'm really worried you're having a heart attack. I wouldn't say, I think you're having a myocardial infarction. And then finally, women call us and they are scared and they say, my baby's not kicking as much. They don't tell us my fetus is not kicking as much. So the ACOG and everybody who follows them, you'll notice their language. They're trying to really dehumanize the preborn child. The second thing they're doing is they're trying to broaden that umbrella definition of abortion to include things that have nothing to do with induced abortion, Roe and Dobbs. They actually want to include miscarriage. They have a document. They include miscarriage care under it, and they include even something called perinatal palliative care, which is kind of like hospice. So if a woman is pregnant and her baby gets diagnosed with a life-limiting condition, a potentially life-limiting condition, we can journey alongside that woman, just like hospice does, and we can support her family. We can help with the birth plan and what the plans are after delivery. They actually want to call that part of abortion now. Like they connect abortion and care. Abortion care is their thing. Do not ever, if you're listening, never use those two together, because the direct and intentional killing of a human being is never caring for that human. So the two things that are impacting policy are trying to change definitions to confuse people and broadening the definition of abortion. And if your viewers want to be blown away by something, there's a 1-minute video during now Secretary Kennedy's nomination process, in which Senator Whitehouse from Rhode Island literally says and describes late-term abortion, that he says OB-GYNs from Rhode Island have told me are a childbirth gone wrong. So literally, when I have to do like a stat C-section because the baby's heart rate dropped or something, now that's even being just trying to be described as abortion care. And that's the reason is because they want in legislation, they want exemptions, everything to be an abortion, so everything can be exempt. So I've
That's
talked long
crazy.
enough on that, but yeah, it's nuts.
That is wild and evil. Like, to just change the definition of words, that terms that we've used forever, and to just change all that just so. I mean, and let's be honest, and correct me if this stat is wrong, but I think it's correct that the vast majority of abortions are performed for convenience reasons, not for uh, what's the term I'm looking for, as birth control, as a form of birth control, and not necessarily for medical reasons. But if we cast this huge blanket, like you just said, over and make everything abortion, well, then now the state laws, that because now we're fighting this at the state level, and now the state laws, we're seeing things like what happened in Ohio, where we're enshrining it in the Constitution because women think that all these other things that aren't even included in abortion are now included in abortion. It's like, wait a minute, that's none of that is actually abortion. That's wild for me to
Yeah,
see.
the literature really shows that about 80% of abortions are for socioeconomic reasons. So, they're real. I work now in 4 pregnancy centers in North Carolina. So I only see patients at this point in my practice with unplanned pregnancies. And they all come in overwhelmed, scared,
Mm,
alone, often pressured and coerced. And none of them are smiling and thinking lightly about it. They're devastated at the thought of the decision in front of them, but they
mm,
feel like they have no other choice. I've had 5 women who are homeless in the last 6 months say, I don't know where I'm sleeping tonight. I can't
mm,
imagine saying yes to this. So we have to connect them with affordable housing, transportation, childcare that's quality and affordable. There's a whole lot of things that we definitely can do in this administration to support it. In North Carolina, one of the greatest things my state legislation did is they actually, my 90 plus pregnancy centers can get a grant to put a social worker, a caseworker in the office. So when she says to me after her ultrasound, I don't want to do this, but I don't know how I can afford it. I can walk her across the hall and have her talk to the caseworker that my legislation is funding so that she can say yes to that baby. And so I think when we think about what are real world solutions, the pregnancy center world is definitely one of those, but we have to have our state legislators and hopefully federal really support it. And I don't know if you've heard of the Senate or Representative Smith from New Jersey, and some colleagues have a bill out called Let Pregnancy Centers Serve. And I just actually did a briefing on it recently in DC, and it really looks at protecting conscience rights of pregnancy centers, and so that we can't be discriminated against and attacked because we know that they have been vandalized, but also some of our governors, some of our state legislations across this country are coming directly after pregnancy centers and wanting to take away any funding to pregnancy centers, and really not legitimizing the exceptional health care that we provide. So this at the federal level is going to help protect us. So if your listeners really want to help pregnancy centers, that's one way they can call their representatives about that.
yeah. Is there? So I think, yeah, to be pro life, I mean, we have to step up and take care of these women who choose
Yeah.
life. We can't just leave it at have the baby. There's a lot more to it than that. And I think
Yep.
as Christians, especially, and the church especially, should be stepping up big time to do those kind of things. Do you see is there any hindrance? Like if a church is like big into helping women choose life, and then, after the baby is born, like helping them afterwards, has there been any government hindrance in your experience of like, no, we'd rather the state do these things, so we're going to prevent the church from doing these things? Or has it been pretty, like, if a church wants to get involved, it's pretty easy for them to help
Yeah.
with pregnancy centers and be pro-life?
Yeah, I think the churches themselves are preventing themselves from getting engaged more. I have not seen or heard that it's state or federal legislation. The church has to step up. The church has been amazing, but there is so much more that the church can be done. For example, I would love to have a list at my pregnancy center of a list of churches and maybe even small groups within the church. And the woman walks in and she needs temporary housing. And I go, okay, who's up on my list? Oh, it's the small group at Church X. We pick up the phone and have that liaison, and boom, boom. We've got her connected to immediate resources, and we've got her potentially a church family where she can grow in her own faith and be strengthened as a family. I recently was on a panel at UNC Chapel Hill, and I was on a panel with a bioethicist and a palliative care doctor, so end of life, a theologian, and myself. And at the end of the panel, we had a Q&A, and a nursing student said to me this. She said, I was in my nursing class, and our professor told us to never work at a pregnancy center and never send a patient to a pregnancy center, that pregnancy centers have an agenda. She asked me, how should I answer that? And I shared about pregnancy centers, but then I basically said, darn right we have an agenda. And our agenda is to empower women with information as they make a decision of massive consequence, to provide exceptional health care to them in that process, to strengthen families in our community, and to love them the same way Jesus loves us unconditionally. And as soon as I finished that, the theologian on the panel kind of took the mic from me and he goes, everybody has an agenda. He said, that professor who asked you that question has an agenda. So when I think about like the help that women need, I think the church is the number one place that we should be going to it. We need to be, as we say, the hands and feet of Jesus to these women. They don't need shame. They don't need judgment. They need unconditional love in that moment. And they're in a crisis. So we got to immediately answer the needs of that, and then recognize, how do we help them become great parents, great, connected to a church of their desire. So yeah.
Yeah, I think the church has been, historically, at least, maybe not recently, but historically has been a better help to communities than the government ever could be or will be.
Absolutely.
We just need them. The American church has faltered lately in many different areas. So hopefully, if we start seeing that turn around, I think there are talks of revivals happening amongst the 18 to 24-year-olds right now. Let's hope that stays. Now, speaking of legislation and administrations, what positive differences have you seen in pro-life medicine under the Trump administration so far? I know we're still very early into the term,
Right.
but what have you seen? Yeah, what have you seen so far, and what are you hoping that he accomplishes?
Well, that very first week that he was in office was pretty major. I was up for the March for Life. So I think the inauguration was on Monday. The March for Life was that Friday. And we saw some pretty amazing executive orders that really started from pardoning pro-life individuals who had been put into prison for no reason, pardoning them. He cemented the Hyde Amendment, which prevents taxpayer funding of abortion. And so that was wonderful. Came out of the World Health Organization, which we know globally has literally abortion is their answer to every global issue.
Yep.
Took down the reproductive rights.gov website that first week, which basically talks about abortion and is replacing it with other things that we can support women and families who find themselves with unplanned pregnancies, trying to prevent unplanned pregnancies. So lots and lots of things happened immediately. I think, so APPLOG, which is one organization, it's called a C3 nonprofit. We actually also, just this last year, have started a C4 nonprofit called APPLOG Action. And APPLOG Action allows us as trusted medical professionals to be able to help legislators who often aren't healthcare professionals as they're writing bills. It allows us to endorse bills that really, I think, protecting conscience rights continue to be a really important thing. The pregnancy center bill I already mentioned before. The other thing that is really important to APPLOG and APPLOG Action is thinking about the abortion drugs and the fact that in 2023, about 1 million abortions happened in our country, higher than before Dobbs. And 63% of those that we know, many we don't even know, these were only abortion drugs that happened at abortion clinics. We don't even know about the numbers of online. But 63% of those were abortion drugs. And women get no ongoing medical care because our Food and Drug Administration, our FDA, removed the initial safety standards that were needed for women to protect women. And so really providing new data that some of your listeners may have seen last Monday, a report came out actually that looked at insurance claims data and showed an 11% serious complication rate taking abortion drugs. And that is compared to a much lower rate, less than 1%, that is often claimed. And so I tell women when I see them, if you decide to have an abortion, I know your baby's going to die. I don't want you to die too. So, one, online drugs that you can get, like there's no regulation of them. You don't know what you're taking. And they have serious complications. The number one being hemorrhage that can require blood transfusion, that can require you to have a D&C to empty your uterus if they don't work. Much less causing significant pain. Women who've told me who've had babies, it felt like I was in labor again. So what is happening is women and girls are turning their bathrooms in their dorms, their apartments, and their homes into abortion clinics. So every time they go back in there, they have the trauma of what happened in there. And women, I just had a phone call with a woman last week. She said, I was told I was 9 weeks and I passed a baby that was the palm of my hand. And, she was devastated. And they're often told they don't get a good informed consent. If they get one at all, it's often in a group of people. So it's absolutely miserable care these women are getting. And so APPLOG and APPLOG Action, we are really challenging this administration to put those original safeguards back in place so that women, if they are going to have an abortion, they receive ongoing medical care. There's a lot of work to be done.
Yeah, I think that's one of Trump's I don't want to, for lack of a better term, downfall, I guess, but his hesitation to weigh in against the abortion pill. He's kind of hemming and hawing about it when he's asked about it. He's not really committed to looking at those reforms. And like you said, the abortion pill is doing, it's not just a faith issue. It's like it's doing actual damage that even the secular should be able to look at and see like this is bad. So I think Trump needs to weigh in sooner rather than later. I think eventually maybe. My hope is that eventually he will, keep it out of states that have banned it, because he refuses to enforce that. So I hope something changes in regards to that pill, because that pill, you are right, it is 100% dangerous, and it's just wreaking havoc on women, both physically and mentally. And so last question for you, doctor, before we get to some action items here. I want to run through some quick action items, but as of right now, today, what do you think is the biggest threat to the success of pro-life medicine?
It's coming from my own medical community, because doctors are one of the most trusted voices in America. And the other side, the pro-choice side, has used doctors for years and years. The pro-life side now recognizes you can't go toe-to-toe. So, for example, you might have a Senate hearing and you have 3 pro-choice doctors and you have no pro-life doctors battling. Well, we have a seat at the table, and it's APPLOG and it's other medical organizations similar to APPLOG. But I truly believe APPLOG has become, for the issue of abortion, the medical voice of the pro-life community. And it is so important when you look at, for example, state ballot initiatives. You mentioned Ohio earlier. We lost Ohio because the other side scared voters, and many Christians voted for, in their constitution, to be no limits and no barriers on abortion for the entirety of pregnancy. They voted scared and not sacred. When you look at exit polling, it's really astounding, the percentage of Christians who believe life begins at conception, who are Catholic, who go to church more than once a week, evangelicals, voted yes for that amendment, because the other side had a lot of doctors that used words like protection and trust and freedom. And we didn't get in the game, but we got in the game this round, and we got our first victories in Florida and in Nebraska and in Idaho. And when you look at Florida, one of the things I'm most proud of as being a board member of APPLOG is there was a small band of very courageous doctors already in Florida. We were able to partner with them, APPLOG Action. We were able to go down there and build that coalition to over 700 doctors. And that coalition then was able to, we were able to train them to do interviews, to do press conferences, to do op-eds. They actually did 5 press conferences in their white coats, practicing physicians, with Governor DeSantis standing in front of them and then behind Governor DeSantis. And that was because that 76 to 93% of OB doctors, or different types of doctors who don't do abortions, became courageous. And that's a movement that we have plans for all 50 states, from the state legislators to local communities and then federally, to really get doctor voices out there. Because what your original question, what's limiting it, is the American College of OB-GYN, who has basically sold their soul on this abortion policy. And they're trying to have one narrative, and we're changing it. We're changing that narrative, and it's gaining momentum. Yeah.
Love it. Love it. Awesome. There will be links to APPLOG in the show description and ways that you can get involved. Folks, just a couple action items here to end the podcast. Doctor, for our audience eager to influence policy, what are 1 or 2 practical ways they can support pro-life medical organizations such as APPLOG?
Yeah, so you can go to APPLOG, AAPLOG, right behind me, .org/mobilize. And you can find lots of ways to engage there and resources. If you're a healthcare professional, even a pregnancy center, highly recommend becoming a member, because that allows you to get updates regarding our member updates, journal clubs, and a variety of things like that. And then we also have lots of resources for lay people. as well as medical professionals. We have a podcast, Caring for Both, a curbside consult. And we're on social media, pretty much everything from X to Facebook to Instagram. And so you can follow APPLOG and APPLOG Action there. And then for your diehards, we actually have an Advocacy for Life online course. And they can go to the website and learn more about that.
Beautiful, beautiful. I might check out that course myself. I think those are some great ways that you can engage in pro-life advocacy. Some resources that help you engage with confidence. So, how should Christians then engage with their policymakers over the next 4 years of the Trump administration to ensure pro-life values are reflected in health regulation and laws?
Yeah, I mean, the most powerful thing you have is your voice. And that, from the voice, and I mean everything from voting to also how you speak about pro-life issues. If you can come from a place of, it's actually called a trauma-informed, I'll just say place again. I can't think of the word. So think of it this way. If 1 in 4 women in America have had an abortion, millions and millions of women and then their partners, whether they're husbands, boyfriends, someone else, have also known the trauma of abortion. And it's so important to remember that regret and trauma are not the same. And what I mean by that is many women will say, I don't regret my abortion given the circumstance I was in. That doesn't mean they haven't been traumatized by it. So think of a soldier who puts on a uniform. He or she isn't traumatized necessarily they don't regret putting on their uniform, but they may experience trauma from what they see or do. That we know about post-traumatic stress disorder. So we have a lot of individuals in our country, men and women, who have experienced the trauma of abortion. And the easiest emotion is to just be angry. And so that's why you often see on social media and interactions anger. And so if you can have the lens of, I wonder what has happened to that person. I wonder if they've experienced some trauma related to abortion, directly or indirectly. I can be more empathic when I talk with that person. So conversations go really well when the person has to actually talk themselves. So one of my favorite things to do is to say to someone, tell me a little bit more about why you think that way. And then they hear themselves have to explain it instead of me say it to them. So we want to be great listeners when we interact with people. Ask, tell me more. And know that if someone starts calling you names, odds are you've won the argument, right? But we have to lead with love, and we have to lead with knowing that as Christians, we have to emulate Jesus in the way we act. And I think the other thing is we've got to educate ourselves. This is where I think the younger generation is wising up. They see everything on social media that has an embryo, like they see the science and they're like, wait, you're telling me this is a clump of cells? No, I'm reading all about development. Like they are very much wising up to it. I also think women are starting to recognize, I'm they're telling me it's safe and effective and I can just go order it online, but I'm reading stories about women who have all these complications and are dying because they're not, because they're taking these drugs without any ongoing care and not getting great care if they have complications, to be honest. And I will tell you a piece of misinformation that I didn't include before, I got to include now. There is not a single law in all 50 of our states that prevents me as a doctor to take care of a pregnant woman who has a miscarriage, a tubal or ectopic pregnancy, or a medical emergency. And do not fall for the lies that the problem is the laws. The problem is actually we've got to implement the laws better so that doctors understand in all states, yes, you can you can take care of her. And no, there's not been a single doctor in this country who's been prosecuted for taking care of a woman who has a medical complication. Not a one.
That is a great point. I didn't even think about that. Yeah. So great wisdom. Thank you so much, Dr. Bane, for joining us on this podcast and sharing this with us. Now, I know we talked about, again, all these links will be in the show description. We talked about APPLOG. We talked about your podcast. Is there anything else that you want to let us know about or promote?
I would just say, if you're a woman facing an unplanned pregnancy or you have a friend, go to almost every community has a local pregnancy center. If you go straight to an abortion clinic, they are going to assume you want an abortion, and you will not get good options coaching. You won't learn about all the information you need before you make an informed decision. So pregnancy centers offer trusted care, and you can come to us and know we'll care for you.
Awesome. Is there a website that has pregnancy centers listed all over the country, or should they just Google their local pregnancy center, or is there a catalog that they can go to?
Yeah, I maybe should know that answer, but I don't know if there is a directory of all of them. You could easily, a lot of times it's, I want an abortion, where can I go? People will Google that. I would encourage you to Google pregnancy center near me, and that will get you there. And pick up the phone and ask, do you do abortions here? And if they say, no, we don't do abortions, but what we do is we help empower you with information as you're making your decision. We can provide pregnancy tests and ultrasound at no charge, but we don't refer or do abortions. Then you have found a pregnancy center. And then, Jeremiah, I'll do some homework and see if there is a national directory that I'm just not aware of.
Sure.
Yeah. There are affiliate organizations that may have those.
Perfect. Yeah. Send it over. I will include it in the show description if you find it. And yes, please choose life, folks. Also, hit that like button, subscribe to the channel if you're not already, and share the show with your friends, and comment below. I want to know what your biggest takeaway from today's episode was. Let me know. You can find full episodes at christiansforliberty.com. That's the number 4. You can also find them on YouTube and Rumble, and you can find me on X at Jeremiah Campana. Dr. Bane, would you kindly lead us out in prayer?
I sure will. Heavenly Father, thank you so much for this opportunity. Thank you for Jeremiah and his ministry and the work that he's doing. Thank you for everybody who is listening. And God, we just ask you to give us the courage to create and continue to strengthen the culture of life in America and beyond our borders. In Jesus' name I pray. Amen.
Amen. Folks, don't forget Jesus and freedom over everything. Until next time, God bless.